Let me ask you something most men over 60 have never once discussed with a doctor or with anyone, honestly. Is the way you're doing this actually safe for your body at this age? Most men assume this is something you either do or don't do, with no real technique involved, nothing that could go wrong. But in my years as a urologist, I've seen a consistent pattern of older men unknowingly causing real physical harm through habits that seemed completely harmless, simply because nobody ever explained what actually changes physiologically after 60. I'm Dr. Emily Carter, and today I'm walking you through 7 specific mistakes I see repeatedly in older male patients. Mistakes that can lead to genuine physical injury, worsen existing conditions, or mask symptoms of something more serious. This isn't about shame or judgment. It's about the same clinical honesty I'd want you to have about any other part of your health. Before we get into it, if this is the kind of direct, no-nonsense health conversation you appreciate, hit subscribe and drop a comment letting me know you're here. Let's get into it. Coming in at number 7, applying excessive force or pressure, often without realizing it. As men age, skin and tissue throughout the body lose elasticity and become more fragile, and genital tissue is no exception. Reduced blood flow, thinner skin, and decreased natural lubrication mean that force or grip pressure that caused no issue at 30 can cause genuine micro-tearing, irritation, or bruising at 60 or 70. I've seen patients come in concerned about persistent soreness or small abrasions, assuming something was seriously wrong, when the actual cause was simply technique that hadn't been adjusted to match how their body had changed. The fix here is straightforward: using a water-based lubricant, adjusting grip pressure, and paying attention to any persistent soreness as a signal to ease off rather than push through it. That's number 7. What's ahead involves mistakes with more serious long-term consequences. Number 6 is one of the most common patterns I see: dismissing pain or discomfort during or after as simply an unavoidable part of getting older. Pain is never something to simply accept and work around, regardless of age. Persistent discomfort can signal several treatable conditions common in older men, including prostatitis, an inflamed prostate, or Peyronie's disease, a condition involving fibrous scar tissue that causes curvature and pain. Both are common, both are treatable, and both get missed constantly because men assume the pain itself is just a normal part of aging rather than a symptom worth investigating. I had a patient in his late 60s who had quietly worked around discomfort for nearly 2 years, adjusting his own habits to avoid triggering it before finally mentioning it during an unrelated visit. He had a mild, entirely treatable case of Peyronie's disease, 2 years of unnecessary discomfort simply because he assumed it wasn't worth bringing up. If something hurts, that's information, not background noise to tune out. Number 5 involves something many older men never think to connect: how common medications interact with sexual function and safety. Blood pressure medications, certain antidepressants, and medications for enlarged prostate can all affect blood flow, sensation, and function in ways men often don't realize until they notice something feels different. Some blood thinners increase the risk of bruising or minor bleeding from friction or pressure that wouldn't have caused an issue previously. Certain medications also affect sensation directly, sometimes reducing it, sometimes less commonly, increasing sensitivity to the point of discomfort. This isn't a reason to stop any prescribed medication on your own, which can be genuinely dangerous. It's a reason to mention any changes you've noticed to your prescribing doctor, since dosage adjustments or alternative medications within the same class can often resolve the issue without compromising the condition being treated. Number 4 ties back into something I mentioned earlier but deserves its own focus: inadequate lubrication leading to friction-related injury. Natural lubrication and tissue moisture decrease with age due to hormonal changes, meaning that habits that required no additional lubrication decades ago can now cause genuine irritation, chafing, or in more significant cases, small tears in delicate tissue. This is one of the most common and most easily prevented sources of minor injury I see in older male patients, and it's almost never mentioned because most men don't realize their body's baseline has shifted. A simple water-based or silicone-based lubricant resolves this in the overwhelming majority of cases. I always tell my patients this isn't an indulgence or something to feel embarrassed purchasing. It's a basic accommodation for a normal physiological change, no different than needing reading glasses you didn't need 20 years ago. Number 3 is one of the more psychologically driven mistakes, but it has real physical consequences: rushing due to underlying anxiety about maintaining an erection or completing the act before losing arousal. I want to pause here for a moment because this connects to something I think about constantly when it comes to men's health after 60. So much of what changes physically at this age responds well to patience, presence, and simply working with your body's new timeline rather than fighting it. That's actually the entire philosophy behind a complete guide I put together called The Iron Age. It walks through exactly what's happening in your body across every major system: testosterone, sleep, strength, prostate health, and yes, sexual health as part of the full picture, along with a clear step-by-step protocol for working with these changes instead of quietly struggling against them alone. For $49.99, it's less than a single specialist visit, and it's something you can reference for years as your body continues to change. If you've gotten value from these videos, I genuinely encourage you to check it out. Link is below. Back to the mistake itself. This urgency, the quiet anxiety that the window might close, drives many older men to rush, apply excessive force, or push through discomfort rather than pausing. Ironically, this rushed approach often worsens exactly the outcome men are afraid of, since anxiety itself constricts blood vessels and works against the physiological process needed for arousal and function. Slowing down, removing time pressure, and treating the process itself as something to enjoy rather than a task to complete quickly produces both better outcomes and reduces the risk of the physical injuries described in the earlier mistakes. Number 2 ranks above the previous mistakes because the stakes are considerably higher. Failing to recognize when a change in sensation, function, or experience is actually an early sign of a more serious underlying condition. Blood present at any point, even in small amounts, is never something to dismiss and should prompt a doctor's visit promptly, since it can signal anything from minor irritation to something requiring more immediate attention. A sudden significant change in sensation, either a marked decrease or an unusual increase in sensitivity, can signal nerve-related changes worth investigating, sometimes connected to diabetes, which affects nerve function throughout the body, including in this area. Difficulty with function, that's new, progressive, or accompanied by other symptoms like fatigue or chest discomfort, deserves prompt attention given how closely erectile and sexual function are tied to cardiovascular health in older men. I've mentioned this in previous videos, but it bears repeating specifically here. This is frequently one of the earliest detectable warning signs of cardiovascular disease, sometimes appearing well before a heart attack or stroke. Treating any of these changes as simply private, embarrassing, or unworthy of a doctor's visit is a mistake that can genuinely cost men years of early intervention on serious treatable conditions. And now, the mistake I consider the most significant of all, the one underlying almost every other mistake on this list, never discussing any of this openly with your doctor at all. I have had countless patients quietly manage pain, injury, changes in function, or concerning symptoms for years, sometimes decades, simply because this topic felt too private or embarrassing to raise, even with a physician whose entire job is addressing exactly these kinds of concerns without judgment. This silence is, without exaggeration, the single largest driver of the other 6 mistakes on this list. Men who never mention pain never get it properly evaluated. Men who never mention medication side effects never get their prescriptions adjusted. Men who never mention changes in sensation miss early warning signs of treatable conditions. The pattern connecting every mistake we've discussed today is the same. A topic treated as too private to discuss, even when discussing it plainly, would have resolved the issue quickly and completely. I say this to every patient I see, and I'll say it here too. There is nothing you could tell me about this topic that I haven't already heard many times over in 12 years of clinical practice. Your discomfort in raising it is far more likely to cost you than any embarrassment you're trying to avoid by staying silent. Before I close out, I want to address something I think explains why this entire topic feels so much harder to discuss for men over 60 specifically, compared to younger men. It's not just general embarrassment, it's generational. Many of my older patients grew up in an era where this topic wasn't just private, it was treated as something almost shameful to acknowledge at all, let alone discuss with a doctor. That generational conditioning doesn't simply disappear with age. If anything, it compounds because now there's an additional layer of self-consciousness about the topic being somehow less appropriate or more embarrassing for an older man to bring up than a younger one, as though there's an unspoken expiration date on when it's acceptable to still be having this part of your health taken seriously. I want to be direct about this because I see the consequences of it constantly. There is no age at which this stops being a legitimate part of your physical and psychological health. A 75-year-old man experiencing pain, injury, or a concerning change deserves exactly the same clinical attention and the same lack of judgment as a 30-year-old man would receive. The generational discomfort around discussing it doesn't reduce its medical relevance, it just means older men are statistically less likely to bring it up, which is precisely why the mistakes we've walked through today go uncorrected for so much longer in this age group specifically. I also want to spend some time on something that doesn't get discussed enough in this context, how a partner's awareness or lack of awareness plays into several of the mistakes we've covered. For men in long-term relationships, many of these physical realities, reduced natural lubrication, longer time needed for full arousal, increased sensitivity to friction, apply just as much to shared intimacy as they do to solo habits. I've had patients whose partners had never been told about a diagnosed condition like Peyronie's disease simply because the patient himself found it too uncomfortable to explain, even to someone he'd been married to for decades. This silence often created far more relational strain than the condition itself because the partner was left to draw her own conclusions about changes she noticed, usually incorrect ones, rather than understanding the actual medical explanation. I always encourage patients where appropriate and comfortable to loop a long-term partner into these physiological realities rather than navigating them in isolation. Not because every detail needs to be shared, but because partners navigating these changes together with accurate information tend to adapt far better than partners left to guess at what's changed and why. This applies whether we're discussing shared intimacy or simply helping a partner understand why certain private habits or needs may have shifted with age. I also want to address the mental health dimension here directly because I don't think it gets enough attention in this specific conversation. Carrying an unaddressed physical concern silently for months or years, whether that's pain, a change in function, or anxiety about performance, takes a genuine psychological toll that extends well beyond the physical symptom itself. I've seen patients develop a kind of quiet avoidance pattern where an unaddressed concern in this area gradually bleeds into broader anxiety, reduced confidence, and even mild depressive symptoms, none of which the patient initially connected back to the original, unaddressed physical issue. By the time they finally raised it with me, often years later, they were dealing with a compounded problem. The original physical issue, which was usually straightforward to treat, plus a layer of anxiety and diminished confidence that had built up around it in the meantime. This is exactly why I emphasize speaking up early and directly, rather than waiting until a concern has had years to compound psychologically as well as physically. The earlier a straightforward physical issue gets addressed, the less likely it is to develop into something with a much larger emotional footprint. I want to give you something practical here, a simple internal checklist you can run through periodically, the same way you might check in on other areas of your health. Ask yourself honestly, has anything felt different, uncomfortable, or concerning in the past few months that I've quietly worked around rather than addressed? Have I noticed a new medication coinciding with any change in sensation or function without mentioning it to my prescribing doctor? Am I using adequate lubrication? Or have I been experiencing friction or irritation I've simply accepted as normal? Have I noticed myself rushing out of anxiety rather than allowing the process to unfold naturally? And most importantly, is there anything on this list I've been meaning to mention to my doctor but haven't yet found the right moment to bring up? If any of those questions gave you pause, that's not a reason for alarm. It's simply a signal of where to start the conversation at your next appointment. None of this requires an emergency visit in most cases. It requires treating these questions with the same seriousness you'd apply to any other recurring physical symptom, rather than filing it away as something too private to mention. For men who've never actually raised any of this with a doctor and aren't sure what to expect, I want to demystify that conversation a bit because the anticipation is almost always worse than the reality. A good physician will ask straightforward clinical questions, not out of prurient curiosity, but to accurately assess what's happening and rule out or identify underlying causes. You won't be judged, and you won't be the first patient that day to raise something similar, regardless of your age. In most cases, the actual conversation takes a few direct minutes, followed by a plan, whether that's a simple recommendation like adjusting lubrication, a medication review, or further testing if something more specific is indicated. I've watched the relief on countless patients' faces after finally raising a concern they'd been sitting on for months or years, only to discover the actual fix was remarkably simple. That relief, more than almost anything else, is what motivates me to keep making content like this. The gap between how difficult men expect this conversation to be and how straightforward it actually is enormous. And closing that gap is entirely worth the brief discomfort of raising the topic in the first place. I'll leave you with this. Every single mistake we've walked through today shares the same root cause, information that nobody ever explained clearly, compounded by a cultural discomfort around discussing it openly, even with the one person whose job is specifically to help you navigate exactly these kinds of concerns without judgment. Aging changes your body in ways that are entirely normal, entirely manageable, and entirely worth understanding rather than quietly working around. The men who navigate this stage of life with the least frustration and the fewest complications are, almost without exception, the ones who treat this topic with the same open, matter-of-fact approach they'd apply to any other part of their physical health. So here's what I want you to walk away with. The physical realities of aging change how your body responds and what it needs. More lubrication, more patience, more attention to pain rather than dismissal. More awareness of how medications might be affecting things, and far more willingness to bring any of this up openly with your doctor rather than quietly managing it alone. None of these 7 mistakes are shameful. They're simply the natural result of nobody ever sitting men down and explaining what actually changes physiologically after 60. The same information gap I try to close in every video on this channel. Adjusting for these changes isn't a sign that something is wrong with you. It's simply working with your body as it is now rather than as it was 30 years ago. If this was useful or addressed something you've quietly wondered about for years, let me know in the comments. This is exactly the kind of conversation that should happen more openly between men and their doctors, and I'd rather have it directly right here than let another year go by with you managing something alone that has a simple fix. Subscribe if you want more honest, clinically grounded conversations like this one. I'll see you in the next video.